Climate and health intersect, but often each works in different worlds. This month, we will break silos, bring partners together, and build bridges between those who work for cleaner climate and those for better health. Join us in a webinar about why converging efforts to address clean air and healthy lungs make sense. Climate and health intersect, but often each works in different worlds. This month, we will break silos, bring partners together, and build bridges between those who work for cleaner climate and those for better health. Join us in a webinar about why converging efforts to address clean air and healthy lungs make sense.
Good morning, dear participants. Thank you for tuning in early to our webinar. Just a few reminders before we start. Your video and microphone are automatically turned off. During the course of our webinar, you may post your questions using the Q&A box at any time. You can find the Q&A button at the bottom of your screen. Use the chat box to post any comments. Feel free to use our chat box. And this session will be recorded for documentation purposes. We will be starting shortly. Thank you. Good morning, good evening, good afternoon.
Climate and health intersect, but often each works in different worlds. This month, we will break silos, bring partners together, and build bridges between those who work for cleaner climate and those for better health. Join us in a webinar about why converging efforts to address clean air and healthy lungs make sense.
Good morning and good evening to you all. My name is Tuba and I'm the Senior Technical Advisor for Environment and Climate Change at FHI 360 Asia Pacific. I'm moderating this webinar together with my colleague Nilo Yakat from FHI Philippines. Thank you for your time and interest in exploring the climate and health nexus with us. This is our first webinar in a series called Breaking Down Silos. This webinar series is organized and brought to you by USAID's Tuberculosis Innovations and Health Systems Strengthening Project, managed by FHI 360. Before we start, I'd like to encourage you to take a deep breath of fresh air. It's good for our brain, our health, and after all, we do that about 20,000 times a day. I'm zooming in this morning from my home in Melbourne, Australia. Just about 30 minutes ago, I checked, and the air quality index is pretty good. We're lucky because my son has bad asthma. It may not be the same for our colleagues in Manila, Bangkok, Jakarta, Kathmandu, and New Delhi. PM 2.5 concentration in the air is between 2.2 and 5.5 times above the WHO annual air quality guideline. Globally, more people die from breathing than smoking cigarettes every year, believe it or not. About 90% of us breathe dirty air every day. Obviously, we're not equal when it gets to air quality. Over 90% of these air pollution deaths are seen in low and middle income countries. So taking a breath of fresh air is easier said than done. We're here today because we care about climate change and health. We know that air pollution and climate change are closely related. Our changing climate is leading to new, expanded public health threats in communities across the globe. Extreme weather events, flooding, droughts, wildfires, extreme temperatures are becoming more frequent and more severe, creating a cascade of health impacts that are affecting more people in more places. Many health researchers and practitioners like us argue that framing climate change as a human health issue has much potential to prompt transformative policy change. Indeed, the health framing from climate change holds some promise to win the hearts and minds of the public, but there are many questions still to be answered about its true potential. Being a climate scientist, I often see climate change as a multifaceted spans in focus from individual level actions to more radical structural change. But when you look at the climate change and health space, it's somewhat, or maybe has been, skewed towards actions at individual and sectoral levels. So in this webinar, I would encourage you to share your knowledge and experience on cross-cutting solutions and examine how we can bring more recognitions and support required to translate these into actions and actual results on the ground. This webinar is structured in two parts. We have two presentations from our distinguished speakers, followed by a discussion with representatives from the Department of Health, Department of Environment and Natural Resources, and the Philippines Climate Change Commission. We welcome questions from the audience in the Q&A box, as we already announced, and the webinar is recorded. So I'm just checking if we have our representative from the USAID, the Office of Health, here. Oh, okay. Michelle is here. So I'd like to invite Michelle Langali, Director of the Office of Health, USAID Philippines, to give welcome remarks. Thank you.
One second, I'm having computer issues. I have to sign in again.
This is the reality of our virtual
It is.
world. And thanks so much,
Okay.
Michelle, for making the time. And I know, yeah, your schedule is very busy this morning, but we're glad that you're here.
Thank you. Okay, I'm set.
Okay, the floor is yours.
So thank you for having me and for having this event. I want to recognize first Commissioner Rachel Ann Herrera of the Climate Change Commission, Dr. Lynn Villanzon of the Department of Health, Engineer Wiona K. Rativo of the Department of Environment and Natural Resources, excuse me, Mr. Bhushan Tuladhar of USA Kathmandu Clean Air Program, Ms. Kendra Chittenden from USAID Asia Bureau, Ms. Jacqueline McPherson and Dr. Solomon Gurgis of FHI 360, other implementing partners, staff, ladies and gentlemen, Magadanu Magaposa and Yong Lahat. So it's a real pleasure to be with you all today as we mark a really important milestone in the partnership between the United States and the Philippines to eliminate TB in the country. And I represent the United States Agency for International Development, particularly known as USAID. USAID is the lead U.S. government agency for international development and humanitarian assistance. USAID works in more than 100 countries worldwide, and the Philippines remains a key partner in promoting sustainable and inclusive development in the region. So USAID recently launched the new climate change strategy to advance equitable and ambitious actions to confront the climate crisis. And this strategy will guide our humanitarian and our development work through 2030 in a way that is partially different by calling on all corners of USAID to play a part in this whole of agency response. So climate change is a global crisis. As temperatures and sea levels rise, people around the world are increasingly seeing heat waves and droughts and floods and cyclones and wildflowers unpin their lives. Climate change disproportionately impacts people in poverty and who are marginalized. It also affects virtually everything that USAID does and threatens the development progress we have supported for more than 60 years. Air pollution is causing the climate to change, and climate change is also causing air quality to change. Because of climate warming, we experience more extreme weather, such as waves and droughts, which negatively impacts air quality. Exposure to high levels of air pollution can also cause a variety of adverse health outcomes. It increases the risk of respiratory infections, heart disease, stroke, and lung cancer. Exposure to air pollutants have also been associated with health impacts. The most harmful pollutants are also closely associated with excessive premature mortality. 9 out of 10 people worldwide breathe polluted air, and unfortunately, 4.2 million people die from ambient air pollution yearly. In the Philippines, air pollution is causing about 66,000 deaths every year. Clean air is a necessity, not just for a sustainable planet, but more so for human health and well-being. Broad-scale evidence has shown the significant association between ambient air pollutants and the development of TB. However, the impact of air quality on the risk of TB in the Philippines is still poorly understood. Through our decades of partnership, we have significant strides in TB control and improving the health of Filipinos nationwide. However, Filipinos will continue to suffer and be more susceptible to TB if we allow the continued deterioration of the quality of the air that we breathe. As we together continue to recover from COVID to increase our case findings and treatment for TB, we need to be aware of the other environmental threats, including air quality, that can hamper our progress. Hence, we call for a very strong and sustained collaborative partnership towards addressing environmental issues that will improve health outcomes, and hence support TB elimination in the Philippines. We look forward to working with you for clean air and a healthy future. Let us protect the planet and have a TB-free world. Maraming salamat po.
Thanks so much, Michelle, for the warm welcome. And I'm glad to hear that you mentioned the launch of the climate change strategy yesterday. It was on my calendar, and we've been watching this space very closely. So I'm going to, it was midnight for Australia, but I will watch the recording. We very much appreciate the support and the attention from USAID to this topic. Now, I will move to the first session of the webinar, our presentations from two distinguished speakers. They are here to share their experience, their wisdom, provide us with some food for thought and stimulate our discussion later on. I'm delighted to introduce our first speaker, Dr. Kendra Chittenden, Senior Infectious Disease Advisor at USAID Bureau for Asia. Kendra is part of USAID's COVID-19 task force and provides support to TB and global health security program in 32 countries in Asia. She spent 5 years in Indonesia supporting infectious disease science and technology program. Kendra will present evidence links to air quality and lung health. Her extensive experience in different parts of the world will shed light to identifying gaps in knowledge and research, as well as best practices and policies. Kendra, you are zooming in from the US, from DC. I believe it is 9:30 or 9:40 rather, your time. Thank you for accommodating such a late hour, and the floor is yours.
Well, thank you very much. It's a privilege to be here, and I would like to thank FHI 360 for organizing this, and as well to our USAID team in the Philippines and to the other panelists. This is a very important workshop and seminar series, one of three, to really look at the nexus of the climate and the health. And I'm happy today to talk about TB and air pollution, and so far what we know, and a lot more about what we don't know and what we need to know. So next slide, please. So I wanted to start, since it's such a diverse audience today, just giving a little bit of a background on tuberculosis for those that maybe are not working in the health field. TB remains one of the world's leading killers for infectious diseases. Despite it being preventable, treatable, and curable, this really ancient disease continues to kill more people every year than HIV and malaria combined. It's caused by a bacteria that is pretty readily spread person to person through air, through coughing, but even talking and close interaction. TB is mostly known for affecting the lungs and as a respiratory disease, but it actually can infect other parts of the body, including the brains, the kidney, and the spine. So it can be quite a devastating disease in all of its capacities. Immunosuppressed individuals with weak immunity are at much higher risk of contracting the infection. And globally, it's believed that because it's such a communicable disease, that up to a quarter of the world's population, that's 2 billion people, are actually infected with Mycobacterium tuberculosis. But if you're immunocompetent, you have a strong capacity to keep the bacteria in check and prevent it from causing disease, and that's known as a latent TB. But there's a 10% chance with people that have latent TB that over the course of your lifetime, you may end up with contracting the disease of tuberculosis. And that usually happens when you become immunocompromised. And that can happen from a range of different situations, such as HIV, cancer, but also malnutrition. And really, this gets us to the topic of today. It's also the impact of the insult that's done by air pollution on the lungs, and how that may impact your ability to prevent TB or to prevent a latent TB infection from turning into TB disease. So a person with TB can die, and if they do not get treatment. So it's really critical for TB patients to get detection early, and treatment. Treatment is not easy for TB. It's a pretty cheap. There's antibody regimens compared to other diseases, but it does take 6 to 12 months and is more complicated if you have drug-resistant forms of TB. So prevention is really key because it is a challenging treatment to get full compliance with. And just to give a snapshot from the WHO last global TB report, to give you a sense of the impact of TB, 1.5 million people died of TB in 2020. It's the 13th leading cause of death and the second infectious disease killer after COVID. It's estimated that 10 million people fell ill with TB worldwide. 1.1 of those are children. And there's 30 high burden TB countries that account for 86% of all new TB cases. 8 of these countries account for 2/3 of the total. And these countries, India leads the count, followed by China, Indonesia, Philippines, Pakistan, Nigeria, Bangladesh, and South Africa. And as you'll see in a later slide, these are also countries that have high levels of air pollution as well. And USAID is the lead US government agency supporting TB efforts. We work in over 23 high burden countries. So this is a topic that we care a lot about. Next slide. And shortly before the COVID pandemic, in late 2018, at the UN General Assembly, there was a high-level meeting on TB. It was the first time that TB was on the agenda, and there was a global commitment to do something about TB and to really set ambitious targets that we could work toward together. We wanted to diagnose and enroll 40 million people on TB treatment, enroll 30 million on TB preventive therapy, all by 2022. And if you look at the targets here, you can see that we're way behind on the goals that we had set. We were making pretty good progress, and then the COVID pandemic hit. And the COVID pandemic's had a major impact and setback on TB. Over a decade of progress is estimated to be lost due to the inability of people to get tested and treated during the pandemic. Up to 21% less people have received treatment, which comes out to about 4.3 million, and about half of those people could die if they don't enroll in treatment. So this is to say that TB remains a critical global challenge. It's ending the TB pandemic as part of the Sustainable Development Goals for 2030. And unfortunately, given where the targets are right now, and we're way off on our 2022 targets. So instituting a really comprehensive approach to TB, considering looking at all the impacting factors such as air pollution, is critical if we want to get back on track for meeting our goals and sort of ending the TB pandemic. Next slide, please. As well, in 2018, the World Health Organization hosted its first global conference on air pollution and health, and made a call for action to reduce the number of deaths. And there's estimated to be 7 million deaths per year. And that's higher than TB, malaria, and HIV combined. And the goal is to reduce the number by 2/3 by 2030. And this conference was really critically important to raise awareness of the number of people worldwide that live with unsafe levels of air pollution. So it was noted before, 9 out of 10 people live with poor air pollution quality. 80% live in urban areas where there tends to be issues with air pollution. I also raised awareness about the various sources of air pollution. As you can see, the slide shows that air pollution comes from distant sources, from local sources, from water, from agriculture sector, open burning, fossil fuels, traffic. There's such a range of air pollution issues and that present crises in the health for people's health. And it raised awareness about the wide range of impacts, particularly non-communicable diseases, and issues ranging from lung cancer to heart attacks, strokes, and even asthma. But there's been really more limited research on the impact of infectious diseases and how this really impacts TB and other respiratory pathogens, including COVID-19. So in the next slide, I'll talk a little bit about the research that we have seen. So there have been studies looking at TB and air pollution, although there's definitely a dearth of research in this area, and we need to have more research to continue to understand all the ways that that air pollution impacts people's ability to prevent and TB disease. But some studies, both in vivo studies and it's studying these in cities where there's high air pollution, and in vitro studying impact of cells with air pollutant, what we have seen is that air pollutants may directly or indirectly affect the immune processes that inhibit TB in humans. And so that means that upon exposure to TB, the air pollution exposure would increase susceptibility to developing active TB following a primary or a latent TB infection. As I mentioned before, most immunocompetent people mount a pretty strong and effective immune response to TB, but what the data is showing that air pollution impacts multiple factors that help in your body that help prevent the ability to prevent a TB infection and also to prevent TB disease. One is that it impacts the tracheal bronchial mucosal surface that actually helps to clear the bacteria if you're exposed. Also reduces the function of your alveolar macrophages, which are the first line of defense in your body for Mycobacterium tuberculosis. And then it also impacts the ability of your body to make cytokines, which is really important for maintaining a latent infection and preventing that from turning into an active disease. So these various impacts really make you more susceptible to not only contracting TB, but to actually getting the disease. And a lot of studies have been done now in a variety of cities in Africa and also in Asia, as well as in Mexico City, taking a look and showing that TB is more prevalent in people that are exposed to air pollution, particularly indoor air pollution in homes. And that includes, examples, firewood or coal that's used to cook. The biofuels that are used are a real risk factor for TB. As well, we know that research has shown that passive smoking and exposure to secondhand smoke is a risk factor for increasing infection with Mycobacterium tuberculosis and also contributing to more likelihood of developing the disease. And this impacts children more than adults, and children are less likely to get active disease, but we have seen in households with passive smoking that children are more at risk. And then, of course, urbanization is increasing in TB endemic areas. TB, as well as air pollution, impacts the most poor and vulnerable. And pollution is expected to continue to increase in these urban settings because of the greater industrialization, more traffic, garbage burning, and a lack of regulation of air pollution sources. So it's really important to understand the contribution of the risks that we can modify in order to help control tuberculosis. And it's not on this slide, but also air pollution, contributes to asthma. And while the research is still underway to really understand the links between asthma and if that puts people at a higher risk for TB, asthma has been shown to complicate TB treatment, and that there's pharmacological interactions between the two treatments. So it is a complicating factor for having a successful TB treatment if you're on treatment for asthma as well. Next slide. And this is a map that shows the TB incident, the light blues where there's low incident, and as it gets darker, it's the higher TB incident. And this is from the data in the WHO Global TB Report. And then as you can see below are the rates of air pollution globally, and you can see the alignment of where there's high TB incident as well as the high air pollution rates. And if you see the list of countries, you can see here that the high TB burden countries, India, China, Indonesia, Philippines, Pakistan, Nigeria, Bangladesh, and South Africa, overlap a lot with the countries with the most polluted air. India, China, and Pakistan, the top 50 cities worldwide with the highest air pollution are in those 3 cities alone. Bangladesh and Kazakhstan are also high burden TB countries. And so there's quite a lot of overlap where we see the problem with air pollution and TB incidents. Next slide. And so, as we've noted, USAID has a strategy now for dealing with climate change. And last year, we launched a program to deal to help support our climate change efforts called the Clean Air Catalyst. It's a new flagship program at USAID. It's a global partnership by World Resources Institute and the Environmental Defense Fund. This is a project that's managed out of our DDI office, which is Development, Democracy, and Innovation. I'm not going to talk a lot about that project in this briefing. I'm going to talk about a project that our office on the Asia Bureau Health Team funds, and that's USAID's Building Healthy Cities project. It's implemented by JSI. And it's not specifically focused on air pollution, but it is addressing air pollution. And I'll give an example shortly, but the project was really designed to help create healthy urban planning approaches in 4 cities: Indore, India, Makassar in Indonesia, Kathmandu in Nepal, and Da Nang in Vietnam. And the Building Healthy Cities works really closely in partnership with cities, because cities are such a critical partner to address this issue, government working with communities and urban sector departments to build a new vision for healthy planning. And the project really supports engaging citizens and every demographic so that they have a voice, and so to empower citizens to advocate, give them data and support research that helps to come up with solutions that address the need of the community. Next slide. And one of the projects that we're doing in Indore, India, is focused on air pollution. And so the project has helped tackle air pollution through community engagement. And the project is helping build a coalition of trained clean air guides in the communities, over 20, to help raise awareness and develop solutions for air quality issues. The project also supports testing, because it's really important to understand where the source of the pollution is coming from. It's very complicated, and the sources are a variety of sources that also change, with time and throughout the year. So having the data and working with the communities really empowers coming up with local solutions. So for instance, in Indore, what we have seen is that there's been changes based on the data when there's been areas that have seen the traffic, pollution is being driven by transportation. There's been an effort to encourage people to use bicycles to get to work when they've realized that its local crematorium has led to a lot of the burning that's contributing to the air pollution. We're working with the businesses to come up with better practices for burning bodies. And so I think that this nicely highlights, it's not TB focused, but it highlights ways that we can start to engage the community, empower the communities to collect data, to start to identify where the sources of air pollution are, and then to work together to design innovative local solutions that are going to help to change the air pollution situation in your communities. Next slide. And so the key takeaways really are that air quality has to be counted as an important part of an integrative approach toward public health protection. And we really need to increase the research and data collection to continue to examine the impact of air pollution on TB and other respiratory diseases. Also to understand the pollution sources so that we can improve regulation, and we can have more thoughtful urban development, more rigorous health monitoring of at-risk people. And we really need to continue to support these multi-sectorial approaches and innovative strategies that are through the community engagement to come up with local solutions. Last slide. So thank you. I listed some of the sites where you can read more about the programs that you're doing, and really look forward to discussions later. And this is a sort of growing area for USAID. While we don't have any projects globally, at the global level, I should say, that are specifically focused on TB and air pollution, we really applaud the efforts of our teams, such as in USAID Philippines, that are working on this together. And the work that in these discussions really help to sort of drive our knowledge and awareness of the needs in countries so that we can design better programs to support this, so that we can come up with ending the TB and eliminate by 2030. Thank you.
Thanks so much, Kendra. Yeah, I agree. I mean, this kind of discussion is a starting point, is a way to really inspire us, people who are interested in the topic and may not have the knowledge or have ideas but haven't been in any forum, to share. And for me, as a non-TB expert, I learned a lot from the presentation. I particularly like the two maps when you have that high TB burden countries and the PM 2.5 concentration. To prepare for this webinar, I did a bit of research on TB, climate change, air quality, and I didn't find a lot of literature. And I think one of the questions in the Q&A, someone also asked about the implications of research, lack of research and data, and we will go back to that later on. But yeah, implications for further research when you kind of overlay these kind of maps in these particular countries would be really interesting. Your key takeaway message on supporting multi-sectoral innovative strategies through community engagement, such as citizen science and data, is a perfect segue into our second presentations by my colleague Bushan Tiladar. You will hear about this his project with a focus on science, research, civic engagement, and private sector partnership. Bushan is Chief of Party for USAID Kathmandu Clean Air Program, implemented by a consortium and led by VHI 360. With an engineering background and extensive experience working for government and UN agencies and NGOs, Bushan will take us to Kathmandu via this integrated project funded by USAID Offices of Health, Environment, and Education. I always love the stories about the Sattva temples in Kathmandu. Bushan, you now have the floor.
Thank you. Thank you, Tuba, and thank you, everybody, for making me part of this great initiative where we discuss air pollution, health, and climate, the nexus between that. And this is great because Kendra just talked about the USAID project building healthy cities. And if you have noticed that one of the cities that she talked about was Kathmandu. So what we did was really, what we're doing now is following up on what the Building Healthy City initiative did in Kathmandu. And this new initiative called Swachh Awa is supported by USAID Nepal. And we are, as Tuba just said, we are just starting off on it. It's been about 6 months now, I guess. And what I'm going to talk about is just the approach on how we are, taking this issue as we try to address this, pretty complicated issue sometimes, because, air pollution, a lot of times, it's not seen, by a lot of people, and it's not seen as a major issue. Next slide, please. But before I get into the details of it, let me just take you to Kathmandu. I don't know how many of you have been to Kathmandu, but it's a nice city. It's a beautiful city. You're welcome to visit, especially when you just look at the top part half of this picture. We're right next to the Himalayas. The mountains are right there. And there's a national park right next to the city. But there are also about 100 brick kilns in the city that are polluting. There are also, thousands of vehicles and a rapidly growing urban population that makes Kathmandu one of the most polluted cities in the world. It's ranked right there often in the top 100 or so. I wouldn't say it's in the top 10 often, but still. What we also see, as Kendra mentioned earlier, is that air pollution is a big major health risk. It's labeled as by WHO as the biggest environmental health risk. Now that WHO has changed its own guidelines, in its own standards regarding the PM 2.5 levels that are, good, that is required in cities. What it says is 99% of the people in the world are now breathing polluted air. And that results in 7 million deaths, as we heard earlier. And that 7 million really means 13 people dying due to air pollution every minute. So, that's a big number. And even in a small country like Nepal, that translates to 42,100 deaths every year. We had a insurgency a few years back, 10-year-long insurgency, and that resulted in 17,000 deaths. Many people remember that. We had a big earthquake that resulted in 9,000 deaths. But this is much more than all of that combined, and that's happening every year. And Kathmandu, as I said, we have our share of air pollution problems. Even if we look at our annual air, PM 2.5 levels, that's 10 times higher than WHO's guidelines. And this is the context in which we are working on this. The good part is that 2 years ago, the cabinet endorsed a plan, Kathmandu Valley Air Quality Management Plan. And now we're trying to help the government in implementing that plan. And as Tuba said earlier, one of the things that we want to do is look at the approach and how this can be implemented, or how air quality management can be done in Kathmandu. And for that, next please. I just want to tell you the story of the Safa temples. This is a project that was done in Kathmandu about 30 years ago, I'd say. What happened was the then deputy mayor of Kathmandu, who had just been elected, was visiting Eugene, Oregon, which is a sister city of Kathmandu, on a regular visit. The sister city visits, you go, you wine, dine, and so on. But that there he met someone who said that he could convert a diesel vehicle to electric. Now, at that time in Kathmandu, there were 600 or so these diesel three-wheelers that were very polluting. There was like plume of smoke all over because of these diesel three-wheelers. The deputy mayor immediately said, don't just talk about it, come and do something about it. The next thing you know, the guy is with his friend is on a plane in Kathmandu, and they start working on this. So they take one of these diesel three-wheelers and convert it to electric. This happened within a year or so. And then they try it on the streets for about 6 months or so. It's great. USAID then comes in and says, well, why don't we try 7 more of these? So then 7 more of these are converted to electric. Before you know it, you have 7 of these electric vehicles going all around Kathmandu on trial. And then what happened is they sold them to the private sector. A private company was born, it's actually 2, and they bid for it. They took the 7, and now there are 700 of them in the streets of Kathmandu, operating without any government subsidy. And another beautiful part of it is about half of them are really operated by women. So there's women drivers, taking these electric vehicles all around Kathmandu. The story started 30 years ago, and it's still a success story even today. These Safa temples are quite iconic in the context of Nepal. Maybe not as iconic as the jeepneys in Philippines, but still, a lot of people know about them. A lot of people know about this story, and we were inspired by that story, and that's to develop our approach, I think, and what we call the implementation science approach, where we take a proof of concept and innovation, and then take it into a proof of implementation. We try to do it in the field and then scale it up. And that's, I think, that implementation science approach that we took it into this project. Next, please. And then the project was designed with a goal to improve air quality in Kathmandu, but that has to lead to health and educational outcomes. So try to link that. And that's also because within USAID, as Chuba mentioned earlier, it's not the environment cell that is supporting us, not just that, or the health. It's the education, the governance office as well, that is putting their support into this, and that's assisting us in this. So therefore, we're trying to build this together as a governance project, as an educational project, as a health project. And the objectives that we have put for ourselves is, 1, improve government capacity at all levels to work with researchers to drive evidence-based policy formulation, evidence-based action. So that is important, evidence-based action and the willingness of governments to do that. That is objective number 1. Second, we work with the civil society, again, to empower them with knowledge and to support them take action. So engage them in air quality, air pollution related activities. The third is the private sector. And in the private sector, also what we want is the private sector involvement and investment in the sector. So what we'd be doing is supporting private companies with providing mentorship, as well as support to invest in this arena. Overall, it's a 5-year time frame that we're working on. We started in November last year, a budget of 13 million. And as we said earlier, it's one of the first times that USAID is investing in this sector in Kathmandu. And it was inspired by the Building a Healthy City initiative, which is a small initiative that was spread over 4 cities, as mentioned by Kendra earlier. And so we're just taking over from that and building it up again. Next, please. As we said earlier, also, there are a lot of people involved in air quality, and that's one of the challenges that we have. There is the central government, local government, judiciary is involved, the parliament, development partners, NGOs, private sector, academia, a lot. But then ultimately it's the individual who needs to take the decision on what to do, how to protect themselves, how to reduce emission as well as exposure to emission. And when there are a lot of people involved, everybody's business is nobody's business. So coordination is a key, and that's what we'll be working on in this project as well. Next, please. And just the same thing, if you look at, I just wanted to show you how complicated this. I don't expect you to read all that slide, but there, if you just look at all those acronyms, which you're not going to, be able to understand, but they all represent the different ministries involved in air quality management. It's not just the Ministry of Environment. It's the Ministry of Transport, Ministry of, Industries, and so on. How do you bring all this together? Well, we think that it is the local government, the municipality, that is at the center. You will see the 18 municipalities in Kathmandu Valley that will bring all this together. Within the municipality is the education department. They manage the schools in the cities. They manage the primary healthcare institutions in the cities. So that has to be the glue that brings everybody together and to serve a community. So that's what we're working on. Next, please. So the next story I want to say again is a short story, is from 20 years ago. That one, the Safa Temple, was 30 years ago. 20 years ago, what happened was citizens living around brick kilns. Now, this is a picture of a brick kiln that no longer exists in Kathmandu. This type of brick kilns no longer exists. It's called a moving chimney bull trench kiln. But 20 years ago, they did. And then the local people living around it were sick of it, sick of the pollution. So they raised their voices. There were marches, there were rallies in Kathmandu against these brick kilns. In one incident, some people just went there and toppled one of those chimneys as well. But those kind of action from local people is incredible. But what was more incredible was the government then respecting the voices of the people and taking a bold decision to get rid of these polluting brick kilns. And what the government decided was two things. One, if there's an illegal brick kiln, you got to stop now. If you have one of these brick kilns in 2 years' time, you need to move at the new technology. And then what the development partners did was support by providing technical assistance. The other brick kiln that you see in this picture is what we call a VSBK kiln, a vertical shaft brick kiln. And the design for that and the technical assistance was provided by this, the Swiss, the STC. And there was also another project by the Danish that were providing support for the fixed chimney kilns. Lo and behold, 2 years later, the whole industry changed. And I was with another organization and we were doing air quality monitoring at that time. And in a place called Bhaktapur, which has a lot of brick kilns around it, what we saw was the pollution level decreased by 24%. So again, if you look at what happened, A, people raised their voices. B, the government respects their voices and took a bold decision. C, development partners supported this by providing technical assistance. And D, the industry complied and did something about it. And we have cleaner air. That sequence is important. Next, please. So what we're doing in our project also, our mantra is three things. One, local leadership. We want local, local governments, local people to raise their voice to do something about it. We want stakeholder partnership. Everybody pulling in the same direction. Everybody, into this. And bottom line, there has to be community ownership. The community has to take this as something for their own. So that's why we have these three objectives in this project. One, working with the local leadership with the government strengthening their capacity. Second, working with private sector mainly, but also community groups, and working with civil society to create this community ownership. Thank you. Next, please. Thank you for your attention. Over to you, Tuba.
Thanks, Bhushan. I heard the Safa Temple story before, but then you always have new stories to bring in. So very interesting. And to me, it's, we talk a lot about integrated approach. I found it somewhat difficult to implement. And the way the project looked at is, leading to the improved governance, health, educational outcomes. But then you have such a matrix of different stakeholders. And given air pollution is kind of another example of the tragedy of the commons, it is even harder to, maneuver through this terrain of the, a different level of governance. But it seems that you have found the trigger points, and the right sequencing of influence for the project. I definitely watch this space, and I encourage you to do so. Keep in touch with Bushan, with our project in Nepal. I love the leadership, the partnership, and the ownership. The project is in its first year, so we will look for this steep learning curve and the lessons learned to share with other countries. So now we're coming to the end of the presentations, and I noticed that we have a few questions in the Q&A. I will invite Kendra and Bushan back to respond to some of these, and also some of the questions are actually for the Philippines, and our panelists will either get on, answer it live, or give a verbal response later. So maybe one of the questions, I think, the first question, I think really interesting and could provide some insight for us, is the challenges for having limited research about air quality and lung health, or maybe what would be the opportunities if we have more investment and more research in air quality and lung health. What is the business case for that? Kendra, if I would invite you to respond to this, or actually any of the panelists and speakers.
Yeah, sure. I can start, and would love to hear from other panelists and those doing research in the area. The research is hard. I think there's a strong business case to make. I see one of the other comments was, how do you convince people to use alternative energy because it's more expensive, and some clean energy. And I think when you start to do research and make the case, the cost of getting sick and the impact on your lung health, and the potential for days of missed work. I think research really showing that impact of what happens with air pollution and all of the health ramifications is really critical. And it is really challenging. And this is what's driving limited research in the area. I think with all the papers that you read, and a lot of the studies really started in sort of an in vitro system because it was a lot easier to work with cells and just bombard them with air pollutants and measure the impact, looking at communities and taking real life situations and trying to look at the impact of air pollution when there's so many other factors that drive people's health is very challenging. And so looking at studies, it's really impressive. I think what the researchers have done, it takes a long-term commitment. Some of the studies have been ongoing 2-year studies where they've had to really identify cities that have consistently high levels of pollution that people are exposed to, and then come up with a control group that, is relatively, sort of facing some of the same conditions, but living in better air quality. So these are some of the challenges. And I think when doing this research, it takes a lot to sort of sort out the other factors. The people getting TB, is that linkage truly air pollution and not, impacted from other health conditions that people have, their age, other things that immunocompromised. So they really are challenging, but it's so important. And I think it's really, as well, countries like Philippines and across Asia have the capability of such strong research organizations and academic sector working really closely with the ministries of health and having this sort of multi-sectorial approach, working with climate change and environmental experts. And so I think a really great opportunity for countries like the Philippines to continue to really contribute to this. It's complicated. They're long studies, but the impact, I think, of getting this data is just so immensely important for TB and other respiratory diseases.
Thanks, Kendra. And I think maybe a last question for you is someone's interested in good practices or any countries that have good policy and best practices of integrating air quality program and lung health. Do we know that? Do we have some example or evidence on policy and practices?
Yeah, I think that, countries, many countries, particularly high burden countries, we've mentioned here a couple of times India, we've seen Nepal, Indonesia. I think countries have made commitments to improve air pollution and do recognize the nexus of health and all of the ramifications of air pollution. And I think what we see is in some cities, particularly cities that have been designated as smart cities and really are working to really try to quickly improve the air pollution, that is starting to show benefits, on the health of people living in those communities. I think as countries as a whole, it's a long time effort to make those changes. I grew up in Pittsburgh, Pennsylvania, which is one of the most polluted cities in terms of air pollution in the US, because we were, long history of steel and coal. And it has taken decades of having a strong political commitment and using innovations, and still not quite having a good quality air. We've made improvements in many areas. So it really is a long-term effort, but I think we are seeing a lot of countries, particularly in Asia. I think a lot of Asia countries are really sort of leading efforts to really recognize that air pollution is taking measures now is really critical for the health of citizens.
Yeah, thanks for that. And I came across this kind of interesting statistics while doing research for this, that both countries been doing well on food and water, but human being, we consume about 1 kilo of food a day, 2 kilos of water, but 20 kilos of air. But then the work on air quality is just going downhill. I know that we need to move on to the panel discussion, and there are a couple more questions. Bushan, can I ask you to go in the Q&A and address some of the really interesting questions in terms of citizens contribution, the macro level, how to incentivize constituents, that kind of like really brilliant questions. If I could encourage you to log into the Q&A and help to answer it live. Thanks so much. And now I'd like to hand it over to my colleague Nilo to moderate the panel discussion.
Thank you, Tuba. Just confirming if you can hear me.
Yes.
All right. Thank you very much. But before we proceed to our panel discussion, we invite all our speakers, panelists, and participants to kindly open your cameras for our photo opportunity. I will guide us through several screenshots, so please bear with us and show your most winsome smile. So can we get ready for that? Okay, let me see. All right, so for our first panel, Zoom is telling me we'll have just 2 screenshots. So please, may we ask everybody to open your cameras, your video, so we can have our photo op. So another new way of doing things, doing online webinars like this. Okay, so if you're ready, give up, thumbs up. Ready? All right. So our first screenshot, please smile. 1, 2, 3. All right. And we go to our second set. Okay. Smile. All right. Thank you for doing this. So to save on bandwidth, you may now turn off your respective cameras, and we proceed to our next part. Again, our sincerest gratitude goes to our speakers, Ms. Michelle Lang Ali, Dr. Kendra Chittenden, and Engineer Bushan Tuladar for setting the trail to our aim of navigating the nexus between climate and health and breaking down silos between advocates and workers of clean air and good health. And to put our discussions in the context of the Philippines, we thank and welcome our panelists from the Department of Health, the Climate Change Commission, and the Department of Environment and Natural Resources. Each of our panelists will share concrete actions that will meaningfully move the needle on reducing the impact of poor air quality on lung health. Our webinar title tells us breaking down silos. It actually means collaborating. So we will pose the question, how can climate and health professionals alike work together to address the climate and health crisis? We will learn more from a doctor, a lawyer, and an engineer. And we also encourage our participants to continue posting your questions to our panel members in our Q&A box, and we will read them later. So our first panelist is a true champion of lung health. Tracing her roots in civil service from the time she began serving as a rural health physician in the municipality of Dinalupihan, Bataan. Bataan is a province north of Manila, to managing the National TB Control Program, and now spearheading concrete efforts to break down silos as Division Chief of the Healthy Workplace and Environment Division of the Department's Health Promotion Bureau. Dr. Rosalind Vianzon is a key catalyst of the settings-based approach of the Philippines Universal Healthcare, or UHC. So we are eager, we're really privileged and eager to hear your insights. Dr. Rosalind Vianzon. Good morning, Doc.
Morning, everyone. First of all, has been my privilege really to be invited in this kind of a session. Really different because I used to be attending face-to-face events, but now we are in this kind of new normal type of exchanging knowledge in this kind of post-COVID scenario. First, I also would like to thank all the speakers. We have learned a lot from them, given their diversity in terms of the countries where they come from. And we've seen that indeed climate change does not consider any type of country, regardless of where you are from. You have been affected by this ongoing slot that we're facing right now. I agree with all the four types of points that have been raised in terms of research. Indeed, we really need a kind of research in undertaking air lung health and that of your quality air. Of course, linking it with tuberculosis is also important for us, given the fact that TB is an opportunistic infection. It is a respiratory illness, and the end part of TB, which is a chronic obstructive pulmonary type of disease, is always there, just like any type of other diseases, non-communicable diseases such as asthma. However, on the aspect of research, perhaps we can consider also linking the settings where the research should be undertaken, in a sense that we'll have to consider that the setting should be that of a community, which you've heard from the colleague from Nepal, describing how air, lung, and diseases can be affected in a setting called the community. We must not also forget the setting of a school. I'm glad that in the questions there has been an issue raised regarding schools, because we know that any individual, given the privilege of going for education, will always spend most of his life attending schools in their elementary, high school, collegial, and so on. And therefore, in all these kind of settings, school should also be placed as an important aspect for conduct of researches. And number three, after school, you have to consider also the setting of a workplace, because after school, people will go to work or raise their family, and therefore much of their lifetime will also be spent in going to their respective workplaces. So I think in terms of our researches, this aspect should be considered. In the same token, I go for advocacy. because for advocacy, we have to consider the varieties of people that will be benefiting from our advocacy structures and interventions. We can see that the advocacy can work for simple community people. It should also consider that of the schools and that of children and that of any life stage. And of course, we have to consider in advocacy the various life stages that an individual would go through. It may affect a newborn child, a school age, an individual in his working times, and of course, an elderly will also be important to be considered in making these advocacy interventions. And then lastly, while there has been a mention regarding integration or breaking the silos, this is important, but I think everybody should also be considerate in terms of who to link with. We may be linking with appropriate agencies, but of course, part of that one will be really encouraging them to be part of this holistic approach. It is easy to say that integration should be there, but the process of doing so seems to be the more critical aspect that we are facing right now. So on the part of integrating all these public health discussions, I think everybody should be really open in terms of the effect of climate change and the effect of air-lung health to any human being, as I've said, for any age of individual, whether you're a newborn, therefore all our experts in the children's sector should be involved. If you're working with the elderly, our experts from the elderly group should also be involved. And then my last point, perhaps, in terms of going through how we can integrate these things, is the fact that we have also to consider innovations or new technologies. And in this particular sense, I'm looking into, in the Philippines, the Department of Science and Technology, because they would really help us in looking to better alternatives in addressing issues emanating from solid fuels, in issues emanating for cleaner fuels. And I think with all these things in mind, we have to consider these experts of Filipinos whom we can work with in terms of introducing new innovations in addressing these problems of air, lung, and quality air. I think those are my points that I would like to share to the group, that when we talk of this very important topic, let us consider the importance of research, but looking at it in a settings base. Let us consider continuously advocating to people, but again, considering their life stage and considering their settings. Schools and workplaces would be always critical in any lifetime of an individual. And then let's continue the integration, which I've said we have to be open into integration and dealing somehow with critical experts for us to be looking into innovations and developing new technologies. I think that's what we can share as far as Philippines and as far as where I'm coming from, the Department of Health. This is our way forward as far as my position right now, working in the environmental health is concerned. Thank you very much, and thank you for the opportunity given to the Department of Health. Thank you.
Thank you very much, Dr. Lynn Bianzon, and thank you for highlighting research, advocacy, and stressing to use healthy settings, such as community schools and workplaces, as a framework, a working framework for guiding, as a guiding principle, and the life cycle approach to health programming, making the appropriate link, the critical process of integration, and considering innovation and technologies, getting, for example, DOST on board, and maximizing community of experts in the Philippines in our attempt to get that nexus between climate and lung health. Maraming salamat po for those really fine points. Before we proceed to our next panelist, Dr. Lynn, maybe there's a question po related to what you shared from one of our participants. In developing countries like the Philippines po, for example, where solid fuels remain cheaper alternatives to clean fuel. So talking about healthy settings, may concrete way po ba tayo to empower households to make healthier choices for themselves?
Yes, thank you, Nilo.
Yeah.
Thank you, Nilo. For now, we're developing really a framework for the so-called healthy communities in which all households will be tackled in that particular healthy communities. And we're working this out with the ILG because we know for a fact that we are in a devolved setup, and therefore our local government executive should be important in this thing. So I mentioned earlier that innovations or inventions or new technologies should be coming into play as we embark on addressing the integration. So as far as we are concerned, while we are working on a healthy community, we have to factor in the other related departments or national agencies to be able to address these new things that we'd like to see as innovations to address the problems or to address the limitations of solid fuel. So I think my point there is we have to work into newer technologies in terms of addressing that particular issue. Over.
Thank you, Dr. Dean Vianson. We're looking forward to this framework and also trying out these innovations that you mentioned. Looking forward to really creative ways of working together po. Maraming salamat po. We'll probably go back to you later din po for if there are other questions. Thank you very much, Dr. Vianzon.
Thank you. Thank you.
So let us now give a virtual applause to one of the commissioners of the Climate Change Commission under the Office of the President of the Philippines, Commissioner Rachel Ann Herrera. Good morning po, Commissioner Herrera.
Good morning, Nilo, and good morning to all our
good morning
participants.
But before you present po, a little note maybe for our participants, you can visit www.climate.gov.ph and surely we will see the digital handprint of Commissioner Rachel Ann Herrera in the Commission's program on anti-single-use plastic campaign, including the phase-out and responsible transition tracks of the campaign. She has also left an indelible mark advising the Senate of the Philippines in her capacity as a commissioner on landmark climate and environmental laws and international treaties such as the country's accession to the Paris Agreement, a legally binding international treaty on climate change. And kung tama po, pagkakalam ko, the Philippines ratified the agreement in 2021. So please, dear participants, please welcome Commissioner Rachel Ann Herrera. Maraming salamat po, Attorney Herrera, please. The floor is yours.
Yes, Nilo, maraming salamat. And again, greetings to all of our participants online and to the panel of speakers, the experts joining us today. It's an honor to join you on behalf of the Climate Change Commission. I think we were asked earlier on realistic actions that can help move the needle to reduce the impact of poor air quality. And I would like to answer this by providing context. Of course, it was raised earlier by Dr. Kendra as well, that what is really the cost of poor air quality. And I would like to cite a 2021 study by the Institute for Climate and Sustainable Cities and the Center for Research on Energy and Clean Air. And they found that an estimated 66,000 Filipinos die every year due to poor air quality. And the economic cost of ambient air pollution is 4.5 trillion pesos, roughly equivalent to 87 billion US dollars. And this is 23% of the country's GDP in 2019. And if we further break down this amount of 4.5 trillion pesos, it's even more revealing because 4.43 trillion are cases of premature deaths that could have been avoided if we had better air quality, and 24.7 billion from work absences, again, due to poor air quality, and so on. We have a breakdown of this. So looking at the regulatory frameworks in place, we have the Clean Air Act of 1999. That law formulated a holistic national program of air pollution management. But now we see that it's already outdated in terms of the standards of the World Health Organization that were set in 2005 and 2021. So the main challenge here in the Philippines is this gap between what's recommended at the global level as the safe level of air quality and our national standards. And we are happy to note that the author of the Philippine Clean Air Act has called for the creation of a congressional committee, an oversight committee on this law to check, to monitor how it has to be updated. And we are looking forward to this legislative action very soon in Congress. And second is, of course, we want to, we recognize that in terms of realistic solutions, we should look at long-term solutions. And our health sector must be resilient, it must be strengthened so it can protect the most vulnerable from climate change. And our greening program should be expanded. We're talking about the national greening program, and we are looking at also at the strict implementation of industrial standards for air emissions, development by the government of low carbon transport, more bus rapid transit systems, the trains that are already being launched and expanded down from Manila and going north, and increasing renewables in the power mix of the country. For the Climate Change Commission, we're regularly training local government units to do their own greenhouse gas inventory. So they're able to consciously identify the sources of emissions in their locality and address where they can cut, where they can be more efficient. And finally, in terms of biodiversity, on recognizing as well that we must be in line with the UN declaration of this decade as the decade for ecosystem restoration, we have to promote more nature-based solutions for climate action. So in the commission, we're going to ramp up programs in restoring ecosystems, in planting and rehabilitating green belts that serve dual or more than that, no, but at least clearly as both carbon sink and buffers for extreme weather events. Nilo, if I can already also address the point earlier on how health practitioners and climate practitioners can work together to tackle this crisis. It's a bit of a challenge because we are trained to address different variables. We have different skill sets, strictly speaking, but of course we converge at the point where we identify that the main driver of climate change, which is the burning of fossil fuels, is also the main cause of air pollution. And so we converge again at the point where we address these impacts of climate change, which is, as we see, worsening rapidly, not just in the Philippines, but across the globe. And the impacts of climate change is very damaging to human health. And we know that climate impacts will worsen, or the rising global temperatures will worsen vector-borne diseases. We are at constant threat of dengue and malaria here in the Philippines. And with more frequent and intense extreme weather, we will see more deaths, more injuries, displacement of communities. We will see destruction of health facilities, barangay health centers, even hospitals. So all these will bear pressure on our health systems. Just this January, we had Typhoon Odette. No, it landed in the Philippines, and there were 220 damaged health facilities in the regions affected, based on the NDRRMC Council situational reports, and around 2 out of 5 barangay health stations, or roughly 41%, and almost 1 out of 3 hospitals were damaged. So the call or the challenge for us is for health and climate practitioners to recognize that we are working towards the same goal, which is cleaner air, healthier communities, and planetary health, which is also an emerging concern or thematic. So we need a healthier planet to succeed. And just as a final point, I would like to mention that we have submitted our climate targets in the UN Framework on Convention on Climate Change. This is called our NDC, and we have set as a country the reduction of 75% of our greenhouse gas emissions for this decade compared to business as usual. And this is, of course, our investment roadmap to finance our transition towards green technologies, green hospitals, low carbon systems and infrastructure. And we hope that the transport sector, which is already in this commitments through their PUV modernization, their BRT systems, and so on, will be a major driving force as well to reduce air pollution. And finally, health practitioners are trusted by the general public. They are, in many cases, the last resort, and we can rely on health practitioners to convey how climate change will affect health and well-being, and including mental health, lack of nutrition, spread of diseases, loss of shelter and security, and so on. And in the same manner, climate practitioners must also consciously emphasize the health benefits from adapting to climate change and reducing emissions. So we need to start speaking the same language and breaking down our silos. And as I said, just as to sum up, climate smart health facilities, climate smart health sector will be crucial in building climate resilient communities. Thank you.
Thank you very much, Attorney Herrera, how you put succinctly all the actions being taken by the Commission in recent months, including the call for revisiting the Clean Air Act of 1999, and then submission of our new targets, reduction of 75% in 10 years, pollutants in the country. You talked about work in transportation, renewable energy, building smart and green hospitals. Maraming salamat po for outlining those and also highlighting po the need to work with our health experts, with our health champions. May question lang po, is there already a mechanism in place po at the CCA to make this integration happen? Meron na po bang mga coordinating meetings, technical working groups?
Yes, ito pong ating climate targets, which is our national framework, brings together the key agencies. So aside from the Department of Transport, we have the Department of Energy, Department of Environment, Department of Agriculture, which we know is also a main source of emissions, through meat and methane. So this is the technical working group. There is a formal technical working group to pursue a roadmap, a financing strategy as well. Kasi we can talk all about programs and projects, but we need the resources as well to implement them and bring them to the ground, to the frontline communities. And second is in the Cabinet Cluster on Climate Change and DRR. So we have that, and the Climate Change Commission is the secretariat, and our DNR is the chair, and that brings also together around 18 agencies, including our partners, DOH, in there to talk about the priorities of the national government and really pursuing the whole of nation approach to ensure we have climate resilient, sustainable communities moving forward.
Good to hear po, Attorney Herrera. One more point po, you mentioned earlier daw po yung green hospitals. How far has the efforts or yung pong programs on green hospitals progress po with the support of the Climate Change Commission?
Yes, thank you. I mentioned the green hospitals because we are a developing country, the Philippines, and we are accessing the Green Climate Fund. This GCF is the biggest dedicated facility for climate programs and projects. And the money there comes from developed countries. So it's climate justice in action. And the GCF in the GCF, we are trying to develop a project proposal, and I know Dr. Lin is part of the expert side of DOH in trying to push this proposal towards a final version that will be accessing, I think, around 300 million pesos, but the GCF side is around 195 million pesos to develop a green to ensure that we have resilient health systems, health sectors, and really improve our infrastructure so that the next typhoon will not easily down our first responders at the community. So it will generally strengthen health sector resilience.
Thank you, Attorney Herrera, po, for the time and for accepting our invitation. And we look forward to within the next 10 years, how we will progress regarding this integration of air quality, climate change in general with lung health. Time check lang po before we proceed to our next panelist. It's already 10:51. May we ask our participants to just stay put. We'll probably be extending for a few more minutes because of our very insightful discussion, and we're getting a lot of questions from our participants. I think this is really our intention to get the discussion going of this nexus between climate and health. So please stay put. We'll be extending for a few more minutes after 11 a.m. So to continue with our third panelist, so for our next panelist, we could say, pwede ko po bang sabihin, Engineer, that air quality is her cup of tea. From the Air Quality Management section of the Department of Environment and Natural Resources, Engineer Wayona K. Rativo specializes in policy formulation and airshed management. Did you know that, sana tama po ako, Engineer, there are 22 airsheds in the Philippines being monitored by DENR, and reports about air quality in the Philippines come from her office. So please welcome to share with us her insights, Engineer Wayona K. Rativo. Good morning po, Engineer.
Hello, good morning, Sir Nilo. So tama po yun, no? We have 22 airsheds ngayon sa Philippines. So good morning, good afternoon, and good evening wherever you are po sa participants natin. Thank you for inviting us to this webinar, no? For the informative presentations po. So yung concrete actions po ng agency namin, so, yung continuous and improved implementation ng mga environmental laws, rules, and regulations natin relative to the air quality management that were crafted not only to protect the environment, but also to protect the public health, including lung health. So like the crafting of one of our policies in 2020, the revising the guideline values and establishing the air quality index for PM 2.5. So noong 2020 po, sa tulong ng academe and other government agencies po like yung DOH and WHO Philippines din po, nakapag-establish po tayo ng air quality index for PM 2.5 at na-revise po natin yung guideline values natin for PM 2.5. So yung continuous formulation ng clean air policies natin that are science-based, for example, the development and updating of ambient air quality guideline values and air quality index for additional hazardous air pollutants like the black carbon, dioxins, and furans, updating of sa PM 2.5 and PM10 nitrogen dioxide, sulfur dioxide, yung trace metals natin, VOCs, PAHs, and others. No, we know that the hazardous air pollutants are known to cause or are suspected to cause cancer, like the lung cancer. So currently, we are working with the academe, the University of the Philippines Institute of Environmental Science and Meteorology for this. No, other actions po na ginagawa natin ngayon is the monitoring of crematoria na makikita nyo po sa website namin sa emb.gov.ph po. Yung data dito po. Tapos yung ngayon po nire-review din po natin yung stricter emission standards po, mass emission rate standards. Tapos yung designation of attainment and non-attainment airshed areas. So ngayon din po we are collaborating po among other concerned agencies, especially sa initiatives on land use planning and smoking. So we are updating the 10-year action plan, consulting with other agencies po, DOH, DOTR for the the transport roadmap, DOE for their energy roadmap, DOST for technology roadmap, DOH for health plan. So we have airsheds, right? Every airshed we have airshed governing boards na consists of the LGUs, academe, people's organizations, national government, non-government organizations, to formulate policies or to manage air pollution in a specific airshed. So that's some of our actions for the air pollution. So that's all po.
Thank you very much, Engineer Wayona, for sharing yung work on policy formulation and also monitoring the implementation of these policies. No? Being a fan of Korean drama, I actually iniisip ko darating ba sa Philippines yung time that when we wake up in the morning, we get to check our air quality index. Are we leading to that kind of monitoring that our morning news will talk about our levels of fine particulate in the air? Will that be also part of where you are leading in terms of monitoring air quality in the country?
Right now po, yung real-time na air quality index po per area po is nasa app po siya or nasa website po namin. So sa ngayon po, ganun pa lang po. Pwede niyong i-download po yung app or makita sa website natin. I believe dati po, meron po sa news na nire-report yung air quality index na ngayon po, hindi ko lang po sure kung bakit nawala po. Ayun.
Okay, so maybe we'll need more efforts, no, to make that a critical information and also guide health activities of our citizens here in the Philippines. And looking forward to that, Engineer Wayona K. Retivo. Also, you talked about updating po yung mga pollutants in terms of communicating to people when we talk about lung health. Which of these pollutants po are you prioritizing in terms of communication? So para talagang maiwasan nila ang mga sources nitong mga pollutants na to.
Actually, yung mga pollutants po na nire-review po namin is based on the WHO's critical na yung concerns po, pollutants concerns po. So sa tingin ko po, talagang lahat to is very important po na malaman ng tao yung kung ano na bang level niya sa araw-araw, if ever man po na maipasa na po yung policy for this po na kinakraft natin ngayon.
Yes, thank you, Engineer. So looking forward to that list of pollutants so that people will really understand itong mga hazardous pollutants affecting their lung health. And one final question po from our Q&A before we proceed with other questions. Ang dami-dami po natin. So we have a lot of questions. We hope we can respond to them. If not po, we'll ask our experts and panelists to answer them, and we'll provide them as a follow-up to these webinar question. Meron po isang question on a micro level, personal level po. So what message or how do we use or do we convey po to a regular Filipino citizen on what they can do regarding air pollution po? So if there's one key message that you usually share po from DNR to talk about air pollution at a micro level that one individual can do po.
So one individual can do po is the use of non-motorized transport po, such as walking or biking to work, saving energy at saka raise awareness din po. Alam naman natin na addressing air pollution is a multidisciplinary approach, no, that each one of us can be part of the solution. So ayun po, yun po yung pwedeng gawin ng individual para in order to address yung air pollution natin. So biking to work, kanyan, save energy or raise awareness pa po.
Thank you for highlighting that, Engineer. In fact, in terms of integration, that's also one of the healthy lifestyle messages being promoted by the Department of Health. Yung living an active life, walking, biking, going to work, and then from climate side, yung using yung paglimit ng use ng ating motorized vehicles and focusing on physical way of mobility. Maraming salamat, and I think palakpakan natin. How do we give a virtual applause to our three panelists? We'll bring them back, maybe just to read a few more questions. I'll ask help from Tuba. Maybe are there other burning questions we have from our Q&A box for our three panelists who together provided very good insights in our attempt to break silos between climate and health practitioners, advocates, and workers. So Tuba, are there other questions that we need to answer? But also, we encourage our panelists and our resource persons, you can actually respond directly to one of the questions. I guess we have one here talking about maximizing private sector support to this integration of our climate and health work. Maybe Attorney Herrera, Dr. Vianzon can share, are there efforts to involve the private sector? Earlier, Attorney Herrera, you mentioned about working with different sectors po. Attorney?
Yes, thank you.
Yes, apa. Yeah.
The private sector really should be an indispensable partner as we try to build climate resilient systems in the health sector. And they are part of our NDC or climate target formulation of roadmap. And they, in fact, will have to be the driver in terms of the innovation and the influx of green technologies, because while government provides the policy and the regulatory space, it's usually the private sector that will be the engine to bring in this growth of green jobs. And I would like to cite our Green Jobs Act of 2017. Even as the government is still finalizing the accreditation standards, this law will provide incentives for green industries, employers that have products or systems that reduce emissions or help nurture and restore the environment. So these are concrete tax incentives, incentives for customs and duties, and also in terms of the workplace. So this is a way where we try to engage with the private sector. And another thing that I would like to mention is that the Climate Change Commission, together with the Green Force, it's an interagency body led by the Department of Finance and the Bangko Sentral ng Pilipinas. We've developed the Sustainable Finance Framework. So this framework guides investments towards the midterm, the long term, on where our institutions, our financing institutions should bring their investments. And again, it will lay down the space for them to really push for the safeguards in investments, in portfolios, in the value chain of corporations. And we hope that it will not only be for the big corporations, but also for our smaller, medium, and micro enterprises, which make up 99% of the Philippine industry. Thank you, Nilo.
Thank you, Commissioner Herrera. Thank you po for citing the Green Force. We'd like to learn more about the Green Force. Again, maraming salamat po, Commissioner Herrera. Dr. Vianzon, maraming salamat po. And Engineer Retivo, thank you very much po for sharing your insights. This panel discussion will surely be remembered as a breath of fresh air, new, different, definitely interesting and exciting. And before we end today's landmark webinar on air quality and lung health in the Philippines, the first of a series, we go back to our colleague Tuba for a synthesis of key points. Over to you, Tuba.
Thank you, Nilo, and thanks everyone for extending a bit of time with us. Thanks the panelists for your strategic, long-term, and also specific suggestions to tackle air quality, climate change, and health. Now, we heard that the health targets for SDGs is to end TB by 2030. This may not be attainable in consideration of climate change. Now, the good news is, for the first time in COP26 last year in Glasgow, the health community had its own pavilion at the UN Climate Conference, and countries have begun and signed up to prioritize health in their efforts to protect people from the impact of climate change. But we know that implementation has been limited so far. So we've heard from our speakers and the panelists that air pollution is an invisible global pandemic. Now, the overlap between the short-lived climate pollutants and the air pollutants means clean air actions are climate actions. Now, let's take these targeted actions. Greater collaboration across sectors is needed. Why? To create lasting change and improve health outcomes for all. And we look at the health sector and we start asking, where can we start? Now, let's look at how to leverage the power entrusted in health departments and professionals. I think Commissioner Herrera mentioned that we hold the authoritative sources of information. We have the deep experience in identifying vulnerable populations and protecting disease burden and so on. So we are in one position to collaborate with other sectors, and we encourage that from our climate and environment colleagues as well. So to walk away from here, what are the key messages? We talk about research and data collection. It should be inclusive, should be targeted. We're talking about integration of air quality in public health protection strategies. We need to be open to different models. We talk about community engagement. We talk about innovation and technology. And here I'd like people to think beyond the kind of innovation that's technology focused, for example, artificial intelligence or machine learning. These offer great prospects, but also think about innovations in the way that we frame the issues, how we mobilize support and resources, for example, engaging with private sector. I'm so glad to hear about the longer term solutions like climate resilient health, health systems, connecting human and planetary health, and bringing the nature-based solutions. Fantastic to hear about the ambitious NDCs. I think we should all think about how we can bring the 75% of greenhouse gas emission reductions through and with health, climate resilient health and health sectors. So a lot for us to think about and act upon. But just to remind you, this is our first webinar in this series. After this, we will circulate a short evaluation survey where you can tell us how you feel about today, but also give us ideas on how to shape the future topics for the following webinars. We can choose to extend the theme in the Climate and Health Nexus, or we can choose to go deep into some of the topics we touch upon today, some of the recommendations and suggestions. So our team is keen on hearing from you about all actionable catalytic ideas. So to conclude, air free from contamination is invisible, but multi-sectoral collaboration to tackle public health, climate change won't be. Only together we can create healthier communities, countries, and build a more sustainable future, health and climate-wise for all. Thank you for your attention and participation today. Have a nice day and good night.